Catch up on all the live shows right here on africatechradio.com.
And of course, welcome to a great and beautiful day. It's Thursday. It's amazing to be here once again, sitting on this seat and doing what I love to do best, which is talk to people who are doing great and amazing stuff around the world, basically, because right now it's like the world is shaking, moving, and I'm bringing people who are part of that move. And of course, for a positive reason, looking out for other people. Today, we're going to be having conversation that is pretty interesting. It's all about health. I mean, health is wealth, and looking at the aspect of the people who are helping this world to move forward. I'm not talking about innovators right now. I'm talking about womanhood. So if you have a woman in your life, your sister, your mother, your neighbor, your colleague, I think I'll give you some few seconds to get them on to come listen to this show, because it's quite important today, the conversation we're going to be having. But while you're doing that, I'm going to be giving you what statistic has to say about today's conversation, which is around cervical cancer screening. Yes. So according to the World Health Organization, WHO, about 20% of women in sub-Saharan Africa has access to cervical cancer screening. Meanwhile, if you're in Africa, you know this next thing. It's all about the cost, guys. Looking at how the earning power of a woman is not so much, and they have to spend up to 70% of their earnings, monthly income, to go take care of themselves, and for a disease or a sickness, which I think is highly preventable, but due to poor access to prevention, screening and treatment, about 90% of women die from this just because they can't get screened or they can't get treatment on time. And today on the show, I decided to have this conversation with an amazing person who is enthusiastic about biotechnology, and he has a lot of skills in vitro diagnostic, pharmaceutics, sales, medical devices, and of course business development. And also he is the head of East Africa and Anglophone West Africa of Roche Diagnostic. I'm going to be speaking today with Taofik Oloruko-Oba. He's here with me, but not in the studio. He's virtually on the line with me. Hi Taofik, good afternoon.
Okay, how are you?
I'm great, thank you. How are you?
Awesome. Greetings from Nairobi.
All the way. You see, on cruise control, we go out of state. So I'm not doing this just from Nigeria. I talk to people around the globe, and this is Africa continent where we connect. Welcome to Africa Tech Radio, Taofik.
It's a pleasure being here. Looking forward to this.
Yes. So what we do at Africa Tech Radio is we report on technological advancement in Africa. And of course, it's great to have this conversation today. As a woman, mostly passionate about the health of women and utilizing or leveraging on technology as a tool that could help people stay healthy. And I remember 2018, I did something around putting up awareness for cervical cancer screening. So in the past, the problem was most people weren't aware of how to go get screened or the importance of getting screened. So right now it's a different story or different ball game entirely, because when you talk to people about this, it's like they know now, but it's kind of super expensive. So we're going to be dabbling into all of this conversation. But first, I would say, what is your relationship with technology at this stage and time?
Thanks a lot for the question, and I'll go straight into it. So technology drives me as a person. Innovativeness, using technology to solve problems. We've seen how, as Africans, how we've been able to leapfrog using advancements, and we've been able to demonstrate across various sectors, not just from IT to fintech, and in my area in health tech, applying technology to solve our daily problems, to make our lives easier.
So that's your relationship with technology. Makes life easier. I like that.
Absolutely.
And also, you also utilize it for your work, which also is part of helping the world become a better place for everyone to stay in. So let's go straight into today's conversation. Looking at the healthcare landscape in Africa, what could you say about it so far so good?
Wow, that's a very broad question, Buki. For sure, we have a lot. It might be we have come a long way. We have come a really long way, but as always, we have even further to go. The recent 2 years ago, we had the COVID pandemic, And that really held up a mirror to all the gaps we have in our infrastructure, in our systems, in our healthcare systems in general. And while we do have skills, we have very highly skilled people, doctors, pharmacists, lab technicians across the whole continuum of care. But we lack the right tools and the systems to make them work properly. My opinion is we can't do much more, really. Absolutely.
I mean, there's so much more to be done, but we can't override the efforts that have been put into having a better healthcare system for Africans. These days, I see a lot of private sector coming into the space and trying to have their setup for people to be able to get quick healthcare services. What role do you think the private sector is helping when we look at disease pattern, disease control, and the likes of it? What role do you think the private sectors have to play?
To be honest, a very, very big role. The public sector government can't do everything. Mm-hmm. This is the reality. And there are a few things that set the private sector apart, that typifies a private sector company. There's technical expertise, there's the speed of execution, efficiency. And when we bring this as a private sector player in collaboration with public sector focus and needs, and we're able to then now, amplify the impact we have. Basically, private sectors are driven by growth. We're able to leverage on technology to improve our efficiencies, and that's what we do. So I think it's for me, the role we play in disease prevention and care specifically would run from bringing the latest tools that we have to bear in terms of disease surveillance, screening, diagnosis, to treatment and treatment monitoring, and so on and so forth. The whole continuum of care. This is the strength that we play: the innovation and the ingenuity.
Very good. Just looking at the disease today that we are highlighting on, it's cervical cancer. And when you look at the statistics, most African women are prone to this, especially those of reproductive ages. So let's start first by educating most people what cervical cancer is and what are the signs and symptoms to look out for.
That's interesting. Good thing is I'm not a doctor, so I won't go into all of that in detail. But the sad thing, and you are right, this is one of the only cancer or oncological diseases that is preventable. There are others, but this one is clearly preventable. There's a vaccine for it, and it's treatable when caught early enough. And this is why it's such a sad thing that we have. It's right now one of the top killers in terms of mortality. It ranks way up there in our countries. Next to breast cancer, cervical cancer comes, and it's really sad. I'm happy that you mentioned your role you had in public awareness. I think this is super important. The difficulty with cervical cancer is that this is something that it's largely asymptomatic at the start, like many of the cancer diseases, but because it's in the cervix, it's not obvious. It's not like in breast cancer where you could, during your self-breast exam, that you see a lump and then you raise the alarm and then you run. With cervical cancer, it's just a lesion that appears and then you can't see what's going on in there. And that is why screening becomes super, super, super important. And that is why all the guidelines, actually, once you've reached a certain age, you're encouraged to go for screening because you will not see any external manifestations of this disease. By the time you see the lesions, by the time you have the bleeding and the pain, it's late, you see. So this is, I think, where and this is a good, segue into, the role that screening and high quality screening becomes super important, and innovations and technology become super important. What can we do to make it easier for our women to get screened? How do we ensure that the screening is accurate? It's one thing to screen. It's another thing to be sure you use the right methodology that gives you the right result. Otherwise, you would go out there living in a fool's paradise, thinking, okay, I'm free. I don't have, and you're not. So I'll pause there and then for us to reflect. And what do you think?
I was actually reflecting, and when you were bringing up those questions, I wanted to get your opinion as a professional and leader in biotechnology industry. I wanted to get your opinion around this also. The question you mentioned is quite important. Like, so what do you think we can do? The government, the people, what can we really do to open the space for good screening? Because then, when you look at screening, most people will say it's expensive. Healthcare is far from me. Also coming with stigma from people. They really can't share their problems with other Africans or other people close by. What do you think we can do?
Well, first thing, I think we need to recognize the very strong role in Nigeria the Ministry of Health has played, because we were one of the first African countries to look at the screening guidelines and to update it and bring it in line with the gold standard of screening globally. We're probably, I think, number 3 on the African continent, if I'm not mistaken. This was actually back in 2018, thereabouts. So the recognition of the need to screen using the most effective methodology out there is acknowledged. There's actually not just the guidelines, but the policy, National Cancer Care Policy for Nigeria is, up to date, and it's very relevant, and it does recognize the current technologies that this takes place. So from a policy point of view, we are fine. But of course, between policy and implementation, there's a big gap. And that's where what you've mentioned around funding is important. We need to recognize the impact, the health, economic, and the very human impact that cervical cancer plays, and differences in our women, our wives, our mothers, our sisters, and our daughters. And on that front, we need to maybe bring the conversation square and full square to funding, both from the public as well as the private sector. Bring it into the conversation for universal health care. People cannot afford to do these things. How can we ensure that the NHIS, for example, has a provision for screening and treatment, as the case may be? How can we ensure that our various HMOs, our private insurance companies, encourage this? In other countries, private health insurance companies actually encourage and reward you for going for screening. Not only do they cover the cost, but they actually reward you if you go ahead and do this, because they recognize the fact that the cost of treatment far, far, far outweighs the cost of prevention.
Yeah, true. And it saves lives. I mean, we wouldn't have to lose so many of our women, girls. We'll have to bury them or be sad about their loss. So we'll keep them alive with us. Also, I'm just looking at the statistics around, or the survey around the African Union. So they launched the health strategy for 2016, moving all the way to 2030. And the aim of this strategy was to improve the health of Africans through increased investment in healthcare infrastructure, which you said they've been doing, but it's a lot of implementations to still go on in that sector. But then at Roche, I can see you also have strategy to help deliver twice the medical advances, and you're doing this at a reasonable cost to the society, so to help also support sustainable development goals, which I think Lagos State, for example, we've been having conversation on this platform around the sustainable development goals, and healthcare is also one of them. So at Roches, what do you guys offer to people?
Quite a lot, and thanks for that. We do have a 10-year strategy that we've developed in Roche Diagnostic. And maybe to step back a little, Roche is a very unique, just to give you a bit of a highlight on
it's pronounced
who we
Roche.
are and what we do.
I'm sorry, Roche.
It's Roche,
Yes.
exactly.
Okay.
So we have the unique capabilities because this is one company that our solutions span the entire value chain of healthcare, from screening to diagnosis to treatments. So we have our pharmaceutical divisions with cutting-edge products and solutions for treating cancers of various forms, infectious diseases, and so on and so forth. A very wide array of solutions. And before that, we have our diagnostics, which is where I belong, where we do, we have solutions, platforms, instruments for screening and diagnosis all over the world. We have played a very strong role in Africa. We have been very, very instrumental. We played a very strong role in infectious diseases such as HIV. We're a strong partner with all the stakeholders in that place. Mm-hmm. We were instrumental in the recent COVID pandemic using already established infrastructure. So these are the kind of things that we do and we continue to do. HPV, which is the HPV DNA, which is the current gold standard for screening cervical cancer. Are things that are solutions that we have embedded into the ecosystem in Nigeria, for example, as well. So what do we do? To answer your question, we have been able to establish and provide the technology to do the screenings and diagnosis of a wide range of diseases, cervical cancer inclusive. And we've been able to do this at very competitive costs, working with various stakeholders in the field, working with NGOs, with funding organizations, working with the government, and so on and so forth. So we believe very strongly in partnership. There's no one organization in the world that can carry the weight of the healthcare burden alone.
I like that you have competitive cost, because most people want to go not just the cost, where they're well taken care of, and you've highlighted the equipment you're working with, and you're guaranteeing that they're going to get a very, very good screening, not just for cervical cancer, for other diseases also. But then let's talk about the stages of diagnosis, because most people wait till late before they start seeking help. So what do you advise people in regards to early detection and diagnosis?
Thanks a lot for the question, Buki. And the mantra, again, maybe speaking specifically to cervical cancer, but in general, is to screen and to screen early. For our women, once you're into your teens, you need to get screened. Follow the guidelines, follow the recommendations, get screened. Use the best quality screen out there. They're well-established networks. They're very strong, powerful NGOs in Nigeria that are recognized worldwide, by the way. So we do have a wealth of resources that are available for counseling, for guidance, for testing, for screening testing and treatment. We are blessed, actually, I think, from that regard. What is lacking maybe is just the awareness, and we need to increase the noise level.
What do you mean by the noise level?
What you're doing right now, talking about it.
Ensuring
that
yeah.
Good noise, yes, you see. And let's be consistent with it. Let's spread the word. Let all our communities be on the same page. We should not be disadvantaged by virtue of where we are. We shouldn't be disadvantaged by virtue of our geography. It shouldn't be because I'm in a city like Lagos or Abuja that I have access to all these solutions. Wherever I am in the Federal Republic of Nigeria, I should have access to screening and proper treatment. And this can only happen if we have a coordinated means of A, spreading the awareness, and B, ensuring the infrastructure is there, and C, ensuring that the funding mechanisms are in place. So these three things are integral, and you cannot have one without the other.
Yeah, that's really a good point. I'm seeing reports here that in May this year, the resolution on strengthening the diagnostic capacity was officially adopted by the WHO and the World Health Assembly also. So what are the implications of this resolution, especially looking at addressing the dual burden of communicable and non-communicable diseases, especially again in the low middle income countries? Now, looking at Africa in general, not just Nigeria, not Nairobi.
Absolutely. That resolution has been something that has been in the works for quite a while. And maybe to break it down so that we really understand what this means. So in May this year, there was the meeting at the World Health Assembly where the resolution was made that we need to strengthen our internationally the diagnostics capacity. why is this important? Now, it's interesting to note that less than 1% of global health budgets are actually spent on diagnostics. This is interesting. Then what are we treating? How can you treat what you don't know? So this recognition at the World Health Organization's level acknowledges that public healthcare's problems can only be solved effectively by having effective and capable diagnostic systems set up and embedded in the infrastructure. Although it's only a resolution, it's not legally binding. It basically helps us to recognize that the WHO has seen the importance of diagnostics, and the resolution actually contains some very clear recommendations and calls to actions for all the member states, and helps them to push towards this mind shift, away from what we used to do before, and helping us urge our policymakers to commit and establish national diagnostic strategies. And this is the key thing, because we do not in general have a national diagnostic strategy embedded in our healthcare policies.
So what do you think is the way to go to embed these policies, and what policy would you like to see on there? What policy exactly?
Yeah, you see, policy, it's not easy to set up policies, but then when you have the kind of guidance that the WHO has provided, it then now helps us to move in that direction. So it begins with having the necessary conversations with the relevant stakeholders within the countries, the ministries of health, even the ministries of finance, NHIS. We need to have these very robust conversations, and then now embed a long-term vision. You can't have short-term strategies. We need to have that mindset that, look, I need to have a 10-year plan, and I'll break it down into small pieces. I need to look at sustainable funding models. I need to look at availability and affordability of the diagnostics. I need to look at the disease burden in my country. I need to build initiatives. I need to identify innovative financing mechanisms. I need to look at partnerships between the public and private. I need to look at international funding opportunities. All sorts. There's so many moving parts, but it all starts with the conversation. It all starts with us having an intention and bringing the right people together to have that conversation and set out the plan.
Yeah, I really like the fact that it's not just a one body thing. It's all the parts coming together to make a mechanical function of the healthcare system. And I'm just thinking at Roche. Roche was recently awarded the WHO qualification for the human papilloma virus, and that's for the testing. So what does this mean, especially for people in the low income area or countries?
That's very good. So it's particularly important for countries in the low to middle income areas, because the WHO pre-qualification is a sort of a standard. A lot of countries don't have the resources to individually authenticate the quality of, be it a test or a drug or whatever it is. So the WHO does what they call a pre-qualification, where it basically tests and then certifies that this test or drug or whatever it is meets a standard. And so countries that fall into this bracket, it's easy for them to then now adopt this test with confidence that it will do what it says it will do. It helps them in making purchasing and implementation decisions. That's what it is really. And so by WHO pre-qualifying the Roche HPV assay, it gives then a wide array of countries who did not have the capability of ascertaining for themselves the full confidence that, okay, fine, you know what, this Roche HPV test is good. I can go ahead and implement it, adopt it, and use it for my people.
I feel as an African lady, I must say I'm guilty of this. I want to know that where I'm going to is globally certified, especially when it comes to my health. I'm not going to put my health in jeopardy just because I want a cheaper cost, or I think that these people offer me a close to nearly not so good service. So having this qualification by WHO is kind of huge and monumental in building the confidence for women. So once they are coming in, most of their fears are being left at the door because they know they're in good hands, and the qualification actually proves a very reasonable confidence boost for women. And I'm going to ask, especially for people who are listening and they're thinking, how can they get themselves into Roche? What country is Roche established in? Is he in Nairobi? Because I know I'm speaking to you. You're in Nairobi at the moment, and I'm in Nigeria. So for people listening, because we have listeners from Ghana, Ethiopia, we even have from United Kingdom listening to us. So how can people get the access to this healthcare service?
Well, the good thing is that we are everywhere.
Everywhere.
In Africa, yep, absolutely. We're in over 40
That's
countries. We established that we have. My office is in Lagos, by the way.
Oh.
So we are very much present. We've been in these countries for many years. Virtually, I can speak for Nigeria. Virtually every tertiary institution has a Roche platform. So we provide our solutions to hospitals, clinics, and laboratories across. And so it is relatively easy for you to get access to our platforms. Specifically speaking to cervical cancer screening, the platforms that are capable of screening using the Roche HPV DNA screening are also available in Nigeria. We have the largest footprint in Nigeria. So the chances are that if you're in any one of the 6 geopolitical zones, I can assure you that you can get access to the Roche HPV DNA testing on our platform at the major tertiary institutions and laboratories.
Yeah, I was going to ask what other diagnostic service can they get? Because we're just on cervical cancer. What other things can they come in to check for at Roche?
It's much. So again, just to be clear, Roche doesn't offer end users. We work with labs. We have our platforms in various labs in various teaching hospitals. Our platforms, our equipment, our instruments are available in most teaching hospitals across the country. In most of the, in most labs, in most of the, accredited labs across the country. And the good thing about the platforms is that they're able to do a very, very, very wide range of tests. So it is left to the lab, the individual lab or hospital, should they choose to utilize the wide array of tests that these instruments can do. So that is a choice that they need to make. So it's left so as an individual, as a young lady yourself, you walk into, I'm not sure where you're based, but if you walk into
Lagos.
You're in Lagos. So yes. You walk into any of the teaching hospitals in Lagos today, and you ask for whatever test you want to do. The platforms are capable of running those tests. Now, whether or not the institution itself wants to run a test is a different conversation, but the platforms are capable of running the widest array of tests that you can possibly, request for.
I know this next question of mine is a bit tricky because I'm just thinking of my head. So it's not related to some of the questions I was supposed to ask. I know mobile clinic is a thing now. So most people, before they get to the clinic, they like to check their services on their phone. And that's one advantage that technology has given us. So before approaching a clinic, can they know if the clinic is in affiliation with Roche? Is that on?
Not so. For the moment, this isn't a solution that is available. It is an interesting thought, by the way, but the moment, this is not something that is on offer.
Okay, my last question then would be around data, because right now, especially when it comes to health, I think the fintech sector, they've gotten so much solution in that regard. Gathering data, especially around health concerns. What do you think is the way to go for Africans?
I think this is a super important area. With data comes the power to make the right decisions, informed decisions. And with all the platforms that are out there, the capability of using IT to link them together, gather the data, and use the accurate data to make decisions is super important. Our solutions have the capability of helping our policy makers. We have the capability of, aggregating the data, sharing that data, and analyzing that data to help our policymakers. This is the name of the game. This is the next big thing, to be honest.
Thank you so much for that. It's been a wonderful moment with you on the show today. I think there's so much insightful things you've said, and very educational also, in terms of awareness, in terms of what stakeholders and government policy makers can do. I'm about to just go off because we have other things to do, and I also know your time is quite valuable, and you decided to share this important moment with us here. Is there any last word you would like to put out for people in this sector, health sector, or people who are just looking to improve their health in general, or people who would like to work or partner with Roche?
That's the wide array, but thanks. I've had a nice time chatting with you.
Thank you.
I hope that we are able to move the needle in terms of the awareness. Cervical cancer should not be a death sentence. Please, please, please go out there, have a discussion with your doctor, request for screening, be screened, and the rest will follow its natural course. In Nigeria, we are blessed. We do have the right people. We have very intelligent doctors, well-trained doctors. They know what to do. So please get screened. That would be my biggest message.
All right. Is there any social media link or websites that they could check on for further information?
For sure. But go to www.roche.com and seek out for HPV. You'll see a lot of information on cervical cancer. You'll see a lot of information there.
Thank you so much, Mr. Taofik, for your time. It's an incredible conversation I've had with you today. I'm sure I'll definitely love a replay. So if you want the replay of this episode, do check our website, www.africatechradio.com. And we also stream on other platforms like Spotify. A couple of them I can't remember off my head. Apple Podcasts. We are on everywhere. Audio Mark. Just think about it. And try to follow us on social media and also. I know Mr. Taofik has to run right now. It's great talking to you. I look forward to having a more futuristic conversation around health care and the health landscape in terms of technological advancement and innovation. Thank you so much.
You're welcome. Cheers and bye-bye. Have a nice day.
Bye. And that's it, guys. So you can follow us on all our social media pages. We are A-Tech Radio on Instagram, Africa Tech Radio on Twitter, and of course Africa Tech Radio on Facebook, to keep up with us and know what we're doing and how we're doing what we're doing by bringing innovators, professionals, experts in all sectors, guys, from finance to health to education. Yes, to even lifestyle, which is what I do on Cruise Control. I look out for everybody.
Thanks for listening, and don't forget to catch up on all the live shows right here on africatechradio.com.